Hello, my name's Damian. I'm one of the consultants here at the Leicester Infirmary Emergency Department, and I'm going to be talking through the use of Nervecentre. So Nervecentre is our replacement for EDIS, which we've been using here for a number of years, but is not really fit for purpose for the new build that we move into in March. And to ensure that we're not both moving into a new build and using an new operating system at the same time, we're going to move Nervecentre in advance of the build. So this is a teaching session on how Nervecentre works, and I'm going to just be talking you through its functionality to make sure that everyone gets the best out of it. So when you log on to Nervecentre, you're going to need to input a username and password, which you will receive shortly. The key difference between Nervecentre and EDIS is that for many years we've not had to log on to EDIS. And while that's made the system very easy to use, it's not really in keeping with current information governance guidance. So that every time you go to Nervecentre, you will need to put in a username and password. However, although that sounds like a great deal of extra work, the Nervecentre will remember your settings, and actually when you log in, it will take you back to exactly where you were the last time you used it. And the way that Nervecentre works from a server-based system is you will find it is infinitely quicker than EDIS and much more user-friendly in that respect. So we start off by typing in a name, and you will also need to put in a password and then log in. This will bring you to a Nervecentre home screen. The key thing to note is that Nervecentre is also used by other wards throughout the hospital. And although this home screen here doesn't look very ED friendly, it is designed this way because there's lots of other different wards and environments using Nervecentre throughout the hospital. The screen that we will use in the ED will be patient list. And patient list is up here, and you just do a single click. And that will bring you to the screen that you were last on when you logged into Nervecentre. For the purposes of this demonstration, we've created an ED training area, which is why the area is named as training. So that's down here. But in reality, there will be lots of different areas such as majors, minors, children's majors, etc. So how does the Nervecentre ED operating system work? Well, actually, even from looking at it from this angle, you'll see that it's very similar to our EDIS system. On the left-hand side, we have the DPS score, a name of the patient, their age, how long they've been in the department, and then to where they are in the department, who they've seen by, what the diagnosis is, and what tasks need to be done on them. And that's fairly self-explanatory, but we'll work through each of the columns so that you understand how they work and how you can change them. So we'll start off with the DPS. So the DPS is on the left-hand side, and to change a DPS or add one in, you just left-click on it, and that will bring up what you want the dynamic priority score to be, and I can change this patient to 2 and then save it. The DPS numbers are red for 1, orange for 2, green for 3, and blue for 4, as we had previously. Next to the DPS is allergies, and you will see that if you hover over the allergy button, it will tell you what the allergy is. If you click on the allergy with a left click, you will be brought up to a new screen. And one of the changes compared to EDIS was that we are now searching for allergies, and this will also apply to diagnoses, from a nationally agreed database, so that you will need to input the allergy that you're looking for, and that will bring up a list of options which you can click on, and then you will need to select to confirm that you have chosen that allergy. And you will see that allergy to fish has appeared in the selected column. If you've made a mistake, you can just deselect, and you will see that the allergy disappears. You can then save all the choices that you have made. The next column are alerts, and that works in exactly the same way. We have decided to separate allergies and alerts, so that allergies is just those substances that a patient is allergic to, whereas alerts are things like patients who have presented multiple times and we know they've got a particular condition, or that they've got a particular plan in place for managing that patient. You then get the name of the patient, their gender, and their age. If you need to go into a particular patient, you just click on the name of the patient, and that will take you to their screen, and we will cover that in a second. The time that the patient being in the department is the same as EDIS, so that between 0 and 60 minutes it will be blank, or there will be no colour. Between 60 minutes and 120 it will be green. From 120 to 180 it will be orange, and beyond 180 it will be red. Now, the assessment process, i.e. what happens to a patient when they arrive, is in the next column. And in order to input what a nurse or doctor has done, you will need to left click on the patient. So let's take this patient here, and it will bring you up 4 options. Those options are being seen by a stat clinician, having a primary nursing assessment, so that's in the back of an ambulance, or the VAC as we use in paediatrics. Then there's the more formal secondary nursing assessment, or that they could have had an assessment in the urgent care centre, and you can just click on whatever you want to choose. You can click multiple components so that the patient can have had their primary nursing assessment and their secondary nursing assessment, and then you can save those choices. And you'll see on the screen that it now appears that the patient has a P and an N. When that assessment has taken place, that patient then moves to a particular area of the department, and this is changed by clicking on the area tab. And you'll see in this screen that there's a number of options for where the patient is. So let's move this patient into majors, and you will be given a bay to move the patient to. You will see that some places are already taken by other patients. Now, when you click on a patient into a different area, you will find that they move off the screen that you were on. So if this area was assessment and they move to majors, they will disappear off the screen because they're no longer in that area. If you do need to find out where a patient is, the place to go to is the top right-hand corner. And clicking on with a left click will bring up all the areas in the department. And you will see that all your most recent places are included. So all the ED patients in department, ED majors, ED minors, etc. Now, the key thing to note is that there are a lot of different wards or environments on this screen. And the reason for that is Nervecentre is shared with other different hospitals. Don't get too alarmed by that. The more you use Nervecentre, it will just bring up all the particular wards in your most recent box so that they will all be easy to find. So let's go back into the ED training area, for instance. Okay, so we have selected our patient, we've given them a DPS score, they've been assessed, we've moved them into a particular area. There is also a separate functionality on Nervecentre that EDIS didn't have, which is where we can select where we would like the patient to be, even if we don't have capacity for them to be there at that time. So for example, if resus is very full, you may have a patient in majors who could be in resus, and you can select in the preferred area box where the patient should preferably be. And that will become very useful when we're at capacity, for example. The next line is the nurse and or doctor who has seen the patient. It's very easy to do. Again, just left click on that particular column. And what you will find is that when you are logged in, the first nurse named will be you. So you can just set to you, and that will instantly be sorted out. In this example, because I'm logged in as a doctor, it puts me doctor in the nurse column. But obviously, if you're a nurse and or a doctor, it will put your name there. And actually, that will make it much quicker than when we had on EDIS was trying to find your own name. Exactly the same thing works for the doctor column as well. Obviously, you will be able to select for other staff members if they're seeing the patient and you're just clicking on their behalf. Now, the next column is diagnosis. Now, this is one of the changes that you will see compared to EDIS. So let's select one of the patients. And this patient had presented with a query broken finger. So the blue is their presenting complaint as they booked in. But when the patient's been seen, you want to give them a final diagnosis. So we just left click on this. And what you will find is the browser function very similar to the allergies. And what we need to do is search for the key terms. Let's say this patient did have a broken finger. So we would type in finger into the search bar, and you will see a list of options. And you can select the one that is most suitable for that patient. Now, the important thing is that you also need to select again to confirm that that's the diagnosis that you've made. And you will be given an option of a working or confirmed diagnosis. Now, this is quite important because with SNOMED CT, and SNOMED CT is the name of the repository of information that has been internationally agreed, they don't like using symptoms. so that if you have a patient with back pain, you will find it very difficult to cone for back pain because the system wants you to select, was it actually a muscle injury or a fractured vertebra, for instance. But as you know, in the emergency department, we are working up diagnoses a lot of the time, and we don't actually know what the real diagnosis is, so that you can put it's just a working or work in progress, and you're not committing yourself to that diagnosis. But in this particular situation, we know the patient had a fracture, and we can also choose whether it's left or right. Now, unlike EDIS, we don't have to put in which particular finger it is, and hopefully that will save us a bit of time as well. So when we've filled in the diagnoses, we then save that, and that will show on the screen the diagnosis they've got and whether it's confirmed C or working W. The next column is tasks. This is what we used to call orders on EDIS, and when you left click here, it will give you two options. You will either have ED referrals, and that's when you want to make a referral to a specialist to see the patient in the emergency department. And you can either search via free text or click and get a drop down. When you click on a specialist, you can add in some notes about maybe when they said they would see the patient, or if there's any extra information that is worth giving the orthopedic team or other members of staff in the emergency department. You'll notice that there's a box in the right-hand corner called Scheduled for Later. We won't be using that very much on the first run-through of Nervecentre, but it will start coming into its own as Nervecentre grows within our department and in the rest of the hospital, and we will be able to action tasks into the future and give a time for when something needs to happen. But in this case, we will just add orthopedics to the referral list, and then we just need to close the screen. You will see that orthopedics is in red, and what that means is the referral has been made but hasn't been completed yet. In order to complete the task, i.e. that orthopedics has arrived, we would click on orthopedics with a right click and then click View Patient. You will see on the patient screen that the referral to orthopedics is in the tasks box, which is in the top right hand corner, and then you can click on the orthopedic referral. And what you need to do is do that with the little down arrow, and you can assign that task as completed, i.e. orthopedics have reviewed, or you can cancel the task. Ignore the assign to me option at the moment. That again is a more future use of Nervecentre. And when we move out of this screen, you'll see that the color of the red box has changed. So this is a good opportunity to show you how you move between screens in Nervecentre. The important thing is that the back button has been disabled on the web browser. We don't use the web browser to move through Nervecentre. So what I mean by that is that if you click on the back left button, it won't work. And in order to go back to the main screen, you need to click on Patient List. And you'll see in this screen that orthopedics is turned to grey. There are some other tasks that can be performed. Again, if we left click and then go to ED tasks, we get the same either drop down or data field. So this time let's look for something via typing it in. Let's just say that we want to put a plaster of Paris on a particular injury. And you can see that that comes up as an option, which we can then click on and then add to the task column. So obviously it's not many patients that get a plaster of Paris on their finger injuries, but if you did want to complete that particular task, again you right click on the individual task, click on View Patient, and then assign the plaster of Paris option to be completed. And then we'll go back to the main screen again. As a reminder, just make sure you click on Patient List at the top. In the next column is results. This won't be enabled to begin with, but Nervecentre is working with EDIS, and in the future we will be able to see EDIS results in the Nervecentre system, and we will be able to order tests from within Nervecentre as well. And clearly that's going to save us a great deal of time because we're not jumping between EDIS and EDIS as we used to do in the past. So the next stage is to start thinking about what you think is going to happen to the patient. And for those that are going to need to be admitted, you can highlight on Nervecentre where you think they're going to go. Now, this is not a referral. You're not saying, I've definitely referred to a particular team to see them in the ED. This is about saying, well, I think this patient needs to come in to a ward. So let's, for example, take Betty Muller, who has a urine infection, and you think she's going to need to refer to the medical team. For this, we go to the plan column. At the moment, you can't see that. There's two ways of making the screen a little smaller. And as we move into the future, into the new build, the screens are going to be configured so Nervecentre fits in completely. For the moment, you can either make the column width smaller, and I'll show you how to do that later in the presentation, or you can just scroll along at the bottom. And you can now see the planned column. If we click on that, you will see that there's an ED specialty required box, and we'll just find the medical team in this. Let's say, for example, you made a mistake. It's very easy to just go back in and either choose a different specialty or go to the top and clear that specialty completely. But let's say we want Betty to go to the medical team. And you'll see what that does is it just highlights that she might be going to medicine. You've not completely confirmed that yet. And the final column is about senior review. So for a number of patients, for example, in paediatrics, those less than a year who have a fever need a senior review, you can just click on when that review has taken place, and there will be a list of doctors who can provide a senior review. If you hover over the little tick icon, it'll tell you the doctor who has reviewed them. Okay, so that's kind of the functionality of the main screen. Now we want to do some more bits and pieces in terms of kind of doing the tests required and admitting a patient. And we do all of that through the individual patient detail. So let's click on Betty, and we do this by clicking on her name. And that will bring you up to the clinical screen. Now, the clinical screen has a number of different settings depending on your professional login options. So as a doctor, I see the ED doctor screen, but there are also ED nurse and admin screens and admission screens as well. So on the doctor screen, we can see that who the patient's been seen by, their allergies, their alerts, what we think the diagnosis is and what they presented with. We can also put in some progress notes or clinical notes as we knew them in EDIS, and then also put the investigations procedures that occurred. To put in an investigation, we just click on the box and you get a number of options to be able to select a particular investigation. You can pick multiple investigations and then click on the other box to go back to it. And you can also click that there were no investigations performed. Move off the box to go back to the main screen. There's also procedures, which gives you the same list of options. And these list of procedures are done in the same categories that we had on EDIS, but we've now put them all on one screen. So we hope that it will be a bit easier to find the procedures that you'd like to do, although they are limited in exactly the same way as we used to have on EDIS. In the future, we will be using EOBS, and we will be able to see the observations of each patient in this clinical screen, and that you will be able to see tasks that, i.e. referrals to specialties, or that whether blood tests are available in the tasks box. You will notice that there are some external applications that you can jump straight to. So for example, if you do want to order an X-ray on a patient, if you click on PACS, that will take you to the radiology screen, and you can look up X-rays that have been ordered. But as I say, to begin with, we will still need to go into EIS to make requests, but in the future we will be able to link straight to EIS from Nervecentre. That just won't be the case in December. It's more likely to be in early 2017. So because I've logged in as a doctor, it's brought me straight to the ED doctor screen. If you're a nurse, it will bring you straight to the ED nursing clinical screen, and I can reach that by clicking on the top left-hand corner. And that brings up similar information in regards to the patient. And you can do the same for administration, which gives more clerical type information. And finally, there is bed request information. And this is where we make a decision to admit the patient to a ward. So we can click on the bed request option. and that says whether you're requesting a bed, but it can also information for admin and tracker staff to say that the request has been approved or that the bed's not available yet. You can input the specialty that you've required and where if there are any particular bed requirements, such as do you need a monitored bed or a side room, and how that transport occurs if you're going to a different hospital. There's also the opportunity for senior staff to put in notes about the particular bed request. And that is just a free text box. So now we're going to go back to the main patient list screen. So what we've seen is kind of how the main screen works and some of the functionality within each of the patients. The last stage of the process is to be able to discharge a patient, and we'll do that through the clinical screen. So let's take Alexandra Stevenson, and we don't need to double input information in to be able to discharge them from the department. So if we go to the Depart button, it gives you a list of required fields with which to be able to discharge. The first of those is a diagnosis. And then whether they've had any investigations, whether they've had any procedures, what their discharge destination was, whether there's any follow-up required, what discharge information was given. And then there is a new discharge option compared to EDIS, which is any safeguarding concerns. This option does contain a lot of options, some of which might make you feel a little uncomfortable, but it will be a new national standard soon to be able to code off whether you've had any safeguarding concerns, so this will be a relatively important field. In most cases, we don't have safeguarding concerns, so you can simply click that option. Nothing really changes though, as if you did have safeguarding concerns about a patient, either adult or child, that you would need to fill in an A form and that we would need to follow our normal processes for safeguarding. But just to do that, you click on the safeguarding box and you will see the list of safeguarding reasons. But in this case, there are no safeguarding concerns. Finally, if you want to put some notes on the GP letter, you click on this box and you can add in some free text. And then you just save that option. And if you save the whole screen, you are then able to preview the GP letter. If you do make any changes to any of the investigations or procedures, you'll find that you need to save the screen again to be able to preview the GP letter. You can then discharge the patient and move back to the main patient screen. So that was a quick run through the Nervecentre system. Things are being updated all the time, and it's an evolving process. So there may be minor changes in terms of how we discharge patients or how we communicate with radiology about when X-rays and CTs are ready. For the moment, I think that gives you a good introduction to the field. Please do get in touch with any members of the Nervecentre team if you have more questions. Thank you very much.